Welcome to my podcast, David's Alzheimer's Fight. It's my journey and how I'm trying to help others. I'm David Uhlfelder, and I'm 74 years old. My recent diagnosis of early Alzheimer's inspired me to create this podcast. This is for you to be able to see and follow someone who's living with this disease. My co-host is Dr. Karen Gilbert. She's Vice President of Education and Quality Assurance with the Alzheimer's Community Care. She has a doctorate in nursing and is a certified dementia practitioner. My actions about why I'm fighting Alzheimer's are based on these three guiding principles in my life. The first thing is choice. The only thing in life that you have is the ability to choose between the things that happen to you and how you react. The other thing is change. The only thing that's permanent is change. Don't fight change. Learn to flow with it. Learn to adapt, because you will not win by constantly fighting change. So flow with it. And the other thing is very important is treat others. Please treat others the way you want to be treated. It's very important to remember that when you're talking to others, and no matter what circumstances you're in. Just treat people fairly and equally.
David, you have a great perspective on life and how you are applying it to these recent events and to your diagnosis. I'll tell you a little bit about Alzheimer's Community Care. We've been serving families in South Florida, Palm Beach, Martin, and St. Lucie counties since 1996. We specialize in providing dementia-specific care in our specialized day centers in all three counties. And at the same time, we have a team of nurses and social work professionals who work to support the caregiver. And because we are a nonprofit organization, we are able to provide many of our services at no cost or very low cost. At the same time, we have an extensive education program. We provide workshops and trainings and presentations for family caregivers, nursing students, practicing health professionals, law enforcement, and the community at large. So we are a very busy 30-year-old just about organization. Now, you and I have actually known each other since the early 1980s, but we were out of touch for quite a number of years. In late 2025, you apparently heard about where I work. You had just gotten this diagnosis, and you're thinking, maybe Karen has some ideas for me, things that I could do. And I certainly applauded you for reaching out, for acting so quickly after receiving that diagnosis. And I asked you, how much time do you have? Because I have a lot of strategies to give you. So one of the first things that I asked was, what symptoms did you have? Again, so glad you went to be evaluated. What were the symptoms that you were experiencing that led you to get an evaluation?
Well, I was really getting very frustrated because I was losing words, that I would be thinking of something and all of a sudden it would be gone. And I couldn't deal with that. I just didn't know what was going on. The next thing is I was working with computers. I work with computers as a business, as my profession. And some of the things that I normally would know would just sometimes escape me. I could think about them sometimes and read back, or I'd go back and look at notes. But it was very difficult because I was worried about that. Because of that, that was causing anxiety. And the anxiety was then hurting my career. And my biggest fear was that I was going to do something that was irreparable to my customers and to the business. And I said, no, I can't let that happen. So I decided to sell my business. I was able to do that. And then also I knew that the moment that truly stood out with me is when my doctor, my neurologist said to me, do you want to know? Do you really want to know, or you don't want to know if you have it? I said, I want to know. I need to know because I need to know what I can do to make myself better or go through at least amount of problems as I can and sustain my life as long as I can and not be dependent, not be a burden, but to try to live my life as I do now. So that's what my goal is. And that's why I took various steps to do that.
Well, and I think it's so important that when we seek an evaluation for any symptoms, we want that provider to tell us what they have found. Because once you know what you're facing, you can reach out and try to learn strategies that can hopefully improve the situation. So I think we were on the phone for about an hour and a half in that first call, and we discussed a long list of strategies, of things that I was proposing to you that you could do. And then I emailed you that list. And when we talked about a week or so later, when you attended our annual education conference, I asked you, so what have you done? What were the actions you took right after we spoke?
Well, the first thing I did was I started the Mediterranean diet. I went through and cleared my refrigerator of high inflammatory foods, sugar, processed meats, high fat foods, anything that was just junk that, everybody has laying around their house. And it's, feel good foods. You get in this habit of just, okay, well, this one time won't make any difference. Well, it does. And then I started walking and biking at least 30 minutes a day. I have a daily exercise program on my phone. I was able to sell my business, like I said before, within 30 days, which eliminated a huge amount of stress. I scheduled a hearing evaluation, and I started using my non dominant hand to do things like using the mouse, trying to write with my left hand. And that way I understood that would help to train my brain to learn new things, which helps your brain to be better.
Well, and to make new connections and maybe be able to compensate for some areas that were being affected by the pathology of Alzheimer's, the amyloid plaque and the tau tangles, the two proteins that we talk about. So you jumped on this right away and started making these changes. Now, these changes are known to help people with a diagnosis in early stage, and they are also known to help protect brain health for those of us who may not have a diagnosis, but we're concerned about what could happen down the line. And so it's never too early to adopt these strategies, and it's never too late. And as we go on with the podcast, we will talk more about detail of different diets. I will give a hint, a little spoiler. A lot of the discussion will center on how damaging inflammation is. Inflammation is damaging for the entire body and also the brain. So, a couple of the things you did directly work to tamp down inflammation. The anti inflammatory diet you adopted, getting rid of the inflammatory foods, the sugars, the processed and ultra processed foods, selling the business to decrease your stress takes down inflammation. Ramping up your exercise takes down inflammation. So, just an amazing combination and so important and apparently very effective because within 2 weeks, you told me you were already seeing changes. What changes did you see within those first 2 weeks of making these changes?
Most people I know, I would say, always want to try to lose a few pounds. It's not a bad thing to do, I guess, in most situations. But in my case, I needed to lose quite a bit, and I'm still working on it. But in the first couple of weeks that took place, I was able to lose 5 pounds, fewer struggles in finishing sentences, and I didn't lose my train of thought as frequent as I did before, which was totally amazing. Just in a couple 2 weeks.
Well, I would think the fact that you saw immediate improvement even facilitated your commitment to stick with it. And this is true about these strategies. You do start to see a change very, very quickly. So now it's been about 8 weeks. And what additional changes have you seen now that we're about 8 weeks from that first discussion we had?
Believe it or not, I've lost a total of 15 pounds. That's unbelievable. I don't know if I've ever done that before that quickly, but it's amazing. I can wear clothes that I haven't worn in years. I continue to improve my communications. I do not lose my train of thought as much. I can finish sentences better. My hearing test went very good. So now I have a baseline for my hearing in case something develops with hearing issues in the future.
Getting that hearing evaluation was really important. A recent study indicated that 30% of cases of people with symptoms of dementia, the type of symptoms you're describing, it was a study of several thousand, 30% of them were traced to untreated hearing loss. So you're taking the initiative to get that hearing evaluation. Thrilled to hear that it was normal and you don't have an issue. But certainly if you did, it would have been very beneficial to address it at that time. Everything that's fixable, you always want to fix in any situation. So how about the people around you? Are they noticing a change?
Well, that's kind of amazing too, because without even me asking, they've said to me, wow, things have seemed a lot better for you now. You're talking more as far as being consistent in what you're saying and not losing your thought. My energy is really increased, and losing my train of thought has again been very, very good. And getting back also to, I remember people's names a little bit better now too, which is not something I was always been good at it either. But so these things are amazing. It makes you really feel good. It makes you feel like you're making progress. And that's true with anything you do, is if you can show progress and you feel good things about it, it only makes you do more of the same thing and do things the way they should be, as opposed to bad habits that we all pick up.
Right? Makes perfect sense. So the proof that the strategies are working are the improvements you've seen. And again, they started virtually immediately. And most significantly, people around you are noticing. So that's real objective evidence. And, certainly we hope by sticking with this, you will continue to improve. And nerve cells in the brain will be able to kind of bob and weave around some areas that are affected and be able to make new connections. You talked about using your non-dominant hand as a way to force the other side of the brain to start making some new connections. This is all so incredibly important, and so glad to see how much improvement you've had in a relatively short period of time. So as we go on, I'd like to talk about some of the myths that still circulate here and there about Alzheimer's, and we really want to dispel those myths. The first is that for a long time, in fact, well into the 20th century, symptoms of dementia and Alzheimer's disease were actually confused with or associated with mental illness. In fact, Dr. Alzheimer, who identified the first patient with those plaques and tangles we talked about earlier, way back in 1906, he was a psychiatrist. And his patient, without anyone really understanding what her problem was living in a psychiatric facility. So that actually might have been the starting point of confusing Alzheimer's with mental illness. And so now we're much better at recognizing that it is very different from a psychiatric disorder. It is truly a disease that is striking the brain and causing those abnormal deposits of amyloid and tau proteins, very different from something like schizophrenia or a bipolar disorder. Second myth, many people still believe that Alzheimer's is something you either get or you don't, and there's nothing you can do about it. We now know that's not true. Regardless of family history, regardless of genetics, for many, many people, adopting these strategies will help protect brain health and potentially prevent or at least delay Alzheimer's symptoms. So even if someone uh, is in the cards to develop Alzheimer's pathology, maybe it'll happen at 95 instead of 75, and they'll have all those additional years of independence. So one of the things we know is that those abnormal accumulations of protein, amyloid, and tau can actually start 20 years or more before someone ever has a symptom. And that's why I mentioned earlier that it's never too early to get started with these strategies, because basically what we do in middle age is likely to determine what our brain is like in later life. But again, it's also never too late. And what I really want to emphasize again is that these lifestyle strategies, and there are more that we'll talk about as we get into future podcasts, have been shown to also help those with a diagnosis, but in the early stage. So we need people to recognize the symptoms and get evaluated. Don't be afraid, because if it's identified early, just like any disease, if it's diagnosed early, the interventions that you apply are likely to be more effective. And then the third myth I want to talk about is that our cognition begins to fail just because we get older. And that's not true either. We can expect to live our entire lifespan, whether that's 80, 90, or 105, with intact cognition. And of course, to the extent we adopt the healthy lifestyle strategies, we have help along that journey. So, age is the greatest unmodifiable risk factor. Can't change our age. Women develop Alzheimer's disease about twice as frequently as men. So, we can't change that genetic influence either, but we do have control over our daily choices, something you mentioned right at the beginning. So we look forward to these future podcasts. We'll have experts talking about these individual strategies and why they work, and hopefully inspiring these changes for many.
Well, that's very informative, Karen. And I think it's very important to realize that those healthy lifestyle changes are really something that's quite, you can't make it any better than that. I mean, as far as what you can do for yourself, not only for brain health, but just physical health. Just a lot of people have diseases, and a lot of people have things that are control or happening because they aren't doing things properly. So whether you have Alzheimer's or not, these are all things that need to be done and you should be doing. And even if you just take baby steps, try to do something, but at least try to make those changes as best as possible. On our podcast, we're going to have guests, we're going to have experts, we're going to have other patients, we're going to have caretakers, we're going to have anybody that would like to participate in this, give their point about what's going on and how they're dealing with this, or what they're afraid of. Because we just don't want this for us. We want this for everybody. Well, of course, the reporting on my progress, watching me, seeing me in action, seeing how this progress goes. And hopefully it'll be for many years. I'm hoping this will continue, that I won't get worse, that things will stay the way they are or get better even. So that's my goal. So if I can attain that goal, it's only going to be proof to you that you can do it too. And then most of all, please listen to these podcasts, because hopefully you will learn a lot about life, a lot about eating, a lot about strategies that is all good for everybody, like I've said. So please watch our podcast, listen to our podcast, and tell people about them.
I think it's important to mention too, someone listening might be wondering, were you also taking any specific medications designed for Alzheimer's at the same time? And my understanding is
no,
you're not. This is all lifestyle. So incredibly important. And as we go on and we have different experts, listeners can start to build their own program of the small or large changes that they can make. And also, if you're a caregiver for someone who's beginning to show symptoms, we hope that you'll be inspired to get them to a quality evaluation, get a diagnosis, and then be able to act upon it. And as I mentioned that, I do want to say there are a number of treatable reasons for symptoms of dementia. It's not always Alzheimer's. So again, the earlier you get evaluated, the earlier the providers can find out, do you have a thyroid issue? Do you have a vitamin B12 deficiency? There are a variety of other treatable causes. So again, I want to emphasize we should never be afraid to be evaluated. The best outcomes occur when we have early intervention. So if you know someone who can benefit, please let them know what we're talking about, and do join us each week. In the meantime, we have email addresses if you have a question or a story that you would like to share. To reach me, the email is very simple: education@alzcare.org. So that's education@alzcare.org, O-R-G.
If you'd like to reach me, my email address is david@davidsalzheimersfight.org, just the same name as the podcast.
And if you would like to have that same list of strategies that I emailed to David that first day we spoke in April of 2025, send me an email. I will send that right out to you. Thank you so much for joining us.